We're all familiar, aren't we, with sensationalist medical headlines that can be confusing and distressing sometimes to members of the public. So I just want to share with you some thoughts that I have from my broadcasting experiences to talk about how we can use techniques to put messages across with confidence so that we can tell people what the consensus of medical opinion is in a calm and authoritative way, and to keep things in a good perspective. What would you say has been the main media story this week? Has it been the capability of North Korea to fire ballistic nuclear weapons? Has it been yet more dire warnings about the state of the NHS? I would say that it's more likely to have been the polarised opinions about poor little Charlie Gard, completely stuck in a Great Ormond Street hospital bed, with even the Pope and Donald Trump becoming involved in his case. And surely this would be an area where it should be a sensitive issue discussed between the parents and the doctors, far away from the media circus that has otherwise ensued. So I was involved in this conversation earlier this week on Good Morning Britain, and yet it's taken off. The polarisation of opinion still goes on, and it really hasn't helped anybody to make whatever the correct decision is. So, how do we avoid fake news? How does the media achieve its message? Well, through various means. When we talk about the media, it's not just newspapers, of course, it's TV, it's radio, it's magazines, but these days, increasingly, it's also the internet and it's social media as well. And there are thousands of editors all competing for viewers and for listeners and for readers. Their jobs are on the line. There's huge competition, and they need to attract as many viewers as they possibly can. They want to boost ratings, and sometimes, unfortunately, on the altar of ratings, what is sacrificed is honesty, decency, responsibility, and truth. They want to get our attention, so they are going to grab a headline which may be very sensationalist. They want to sell that newspaper, sell that TV program to you, and they don't mind how they do it. They want to keep your attention, and they want to shock you. They want to keep that attention, and if they have to sensationalize a story, then they will. They want to make you feel something, whether it's anger, sadness, whether it's something for you to identify with, but they want you to be moved by the story. And some stories don't need you to be moved, they just need to be factual. So where, you may ask, is responsible reporting? Where is responsible investigative journalism? Who do we trust anymore? It's a good question. How is scientific information from press releases translated into mainstream media? Well, in various ways. We've talked about headlines. Undoubtedly, people have a shorter attention span than they've ever had before, and editors know this. So they go for headlines, even though the headlines may be misleading. Often, when we look at the guts of a story, there will be statistics which are lifted from the press release, the scientific press release, but those stats aren't necessarily put in a way that is easy to understand. The idea of relative risks is lost amongst most members of the public. So when people talk about the risk of the oral contraceptive pill, or HRT, causing an increased risk of clots or breast cancer, a 20% increase in risk of an already small risk is really something that needs to be talked about in relation to the relative risk. It's not actually a much bigger risk than other people run if they're not on HRT or the pill. But when people read the story written by a non-qualified journalist, it's often very alarming. Another technique that editors might use would be to introduce a celebrity into the conversation. So a celebrity endorsing HRT or rubbishing HRT will influence a lot of people. It's what editors call infotainment. Put a celebrity in there and change people's minds. A Again, polarisation of views, controversy, always is of interest. Piers Morgan does it very well, some would argue, but he is there to play devil's advocate on breakfast television at the moment. So he will take a view, he's the pantomime villain, but he will get heated opinion going, and viewers stay with the programme even if they take a view that it's not that aggressive form of interviewing that they really like. We will see non-qualified, non-medically qualified journalists use a story that they've read and absolutely ruin it. They'll keep it out of perspective and they'll lose the truth in that story. But as Mark Twain said, why would you ever let truth get in the way of a good story? And that's probably even more true today than it's ever been. So how do these things relate to health coverage? Everybody here at the Heart UK conference will know just how confusing it can be when people read stories in the newspapers or messages on TV or on the radio relating to heart disease. How frustrated do we sometimes feel when people see us, clients, patients see us and say, well, you know, you've put me on these statins and these pills and you're poisoning me. It says so in the Daily Mail. We get pretty frustrated, I'm sure. In recent headlines, we've seen in the Telegraph, statins increase the risk of diabetes by almost 50%, according to a study. And people read this, we've got millions of people taking statins, one of the commonest prescribed medicines of all in the UK. People read this, they think, well, there are 3.5 million people with diabetes. There's an epidemic of diabetes out there. I don't want to be one of them. So I think I'll stop taking my statins. Stories, headlines like that can do immense damage. On the other hand, on the same day or a few days later, the Daily Mail will tell us, don't give up your statins. The Scotsman, north of the border there, fear of statins is leading to thousands of unnecessary deaths. So no wonder people are confused. There's a whole book expounding the virtues of aspirin, the wonder drug that is aspirin. Aspirin that reduces blood clots, reduces the risk of heart attacks and strokes. Aspirin that can reduce our risk of colon cancer and cataracts and all sorts of other things, dementia as well. It's cheap as chips. Truly, aspirin must be a wonder drug that everybody should take, whether they've had any problems in the past or not. But not according to, did I miss one there? Yeah, I did. Taking a daily aspirin to prevent heart attacks or stroke is 10 times riskier for the elderly. It could lead to 3,000 preventable deaths in over 75s. So, do we read the book? Do we read the Daily Mail? Who do we believe? What should we be taking? Ibuprofen fares no better. Is it too risky to take? Ibuprofen is one of the commonest anti-inflammatories that anybody takes. You can buy it in supermarkets, you can buy it in petrol stations, and suddenly, headline news, it can give you a heart attack. Taking ibuprofen regularly for just 1 week, according to BBC News, can increase heart attack risk. Pretty scary headlines. Does anybody ever take ibuprofen again? And then HRT, another subject close to our hearts. HRT is safe, reported on the NHS Choices website, and can cut heart attack deaths. Study shows that. Guardian reported today, or the Daily Telegraph said that women should no longer be worried about taking HRT. Fantastic. The benefits just go on increasing until you read something else in the Express. They face an increased risk of stroke if you take HRT. So completely contradictory messages, often on the same day or in the same week. And then the same newspaper, a few days after the previous report, says actually, yeah, you might live longer because estrogen protects against heart disease. So no wonder everybody is confused. High cholesterol, one of the big messages of the conference in the last day or two, I'm sure. You know, the messages have been reinforced. We need to identify those people with familial cholesterolemia, which is talking about that need just earlier today. And on the website for British Heart Foundation, if you have too much cholesterol in your blood, it can increase your risk of heart disease. Well, we've known this, haven't we, for 50 years? We've been saying this.
and so does Heart UK. There it is, cholesterol, know your number and get it lower. This is going to protect you. But not according to another study as recently as 3 weeks ago. A controversial report claims there's no link between bad cholesterol and heart disease at all. And that study got wide coverage. Nor is there any link, apparently, between saturated fats anymore and heart disease. The risk from saturated fat in foods such as butter, cakes, fatty meat is being overstated and demonized. It's reported on the BBC News, study widely reported on. And of course, people say, well, actually, I can therefore eat what I like. Doctors don't know what they're talking about. They can't agree, they change their minds. If they're not sure, there can't be much in it. And I think this is an example of the media being incredibly distressing for the public and potentially quite harmful. So what's the journalist's point of view? And I've been on the journalist side of things as well as an author and as a presenter. And my view is that we all have a role as healthcare professionals to get involved in the media, to guide journalists who aren't qualified into putting across messages in the right way, in a responsible way. So when I went into presenting media stories 25 years ago, my view was always to put a story in perspective, to forget the alarmist headlines and tell people what they needed to know today, particularly if they were taking a medicine or at risk of a certain condition. So the journalist has a role. They want to get the story out there. That's their basic role. Report on the story. And in theory, they should have a duty to make that story accurate, honest, decent, reliable, and valuable, and truthful. But as we know, sometimes they're under huge pressure to sensationalize the headline, and if that means selling more newspapers by being a little economical with the truth, then so be it. And that's a shame. So how can we all change things? I'm sure we would like to get the messages out there in a more accurate way, in a more responsible way. And I would encourage all of you to think about how you put across messages to not just the patient in front of you, but to a wider audience as well. The more doctors, nurses, psychologists, nutritionists, diabetologists, and dietitians out there who are involved in the media, the better. Because people trust you. They don't necessarily trust journalists, but if you've got a qualification, if you've got the experience, and if you've got the wherewithal to put across strong, accurate messages, people trust you as a profession more than any other profession. So, have the confidence to do this. We have to make sure that we have a duty to educate the public generally, and especially in the wake of breaking news and alarmist headlines. It means not being the last to know. How often have we sat in front of a client or a patient and they've come in clutching a headline from a newspaper saying, "You put me on these medicines 5 years ago and now you're poisoning me, it seems." It's not good enough for you to say, "Well, really? I had no idea I was." You need to be across that story before, preferably, it hits the newspapers. And if that means reading up around the subject, being confident about common issues, then we need to do that. But also, as a profession, we need to communicate important messages long before these things are going to hit the media. We should have warning. People know when they've got research papers in preparation, and they should share a bit of knowledge with their fellow professionals in order to pre-warn them about the storm in the media that's about to happen. And it's good to be proactive. So have strong messages in your head about important issues, because you will be confronted by patients, you may be confronted by journalists, you may even be doorstepped by journalists, although that happens less often these days, and you need to be aware of how to handle that sort of situation. So I think there are some rules that are worth being aware of. I think everybody should consider some basic media training. I've seen far too many brilliant professors and academics being absolutely made fools of by not being prepared when they are interviewed. you've got to be prepared, and you've got to know what the media will try to do what they're out there for when they interview you. KISS is an important mnemonic. I'm not talking about the KISS that's just been voted the top one of the 50 movie kisses of all time between who's on the Titanic? Rose and what's his name?
Leonardo.
That's him. Not that KISS. KISS stands for keep it short and simple. You will only get, if you're lucky, in a media interview, on TV anyway, 2 minutes, minute and a half. So there's no point trying to have a long explanation for your point number one, because you'll just get cut off and you'll only have talked about a quarter of the things you want to put across. But keep it short, keep it simple. Prepare sound bites and bullet points. Keep it tight, and you're likely to get the whole of your important points, all of your important points across. Rehearse confident messages. If you can come up with a concise and pithy statement which is likely to be reproduced, then great. And if you've got a metaphor or a simile that people can, relate to, so you can make your subject better understood, fantastic. Anticipate aggressive questioning. Not all interviewers are going to go for the jugular, but some may, and you need to be prepared for it. So rehearse with somebody you know, and be prepared to answer the worst question you can possibly think of, and then you can't go far wrong. Discuss what action is needed with immediate effect, if any. So if you're talking about a problem that's occurred with a medication or with a condition, then give some positive, constructive advice at the end. And it may often be, as it is for me, you don't need to change your medication at the moment without talking to your doctor first. What you've read in the headlines needs to be put in perspective. Don't change anything quickly. That could be worse than anything. Go and get clued up about what it is. And personalise your answers where appropriate. If we're too didactic, if we're too pedantic, people may not trust us. But if we say, personally, this is what I do, or if it was my mother, this is what I'd do, and suddenly we become much more human. And people say, oh, I believe them, I trust them. That was nicely put. So, as I say, to conclude, don't be fearful of the media. The media is the way that we can raise awareness about really important issues. We can talk to one person in front of us, or we can talk to 1 million people in 2 minutes and get that strong message put across to lots of people all at the same time. So we need the media, but we also need to help control the media to put across powerful, accurate messages in a responsible way. Thank you.
Thank you very much for that insight and the tips. I'm sure there are some questions from the floor. Please wait until the mic's near you.
May I ask the first one? Can I ask a question?
Where are you?
Yeah,
Oh, sorry.
One of the problems of the medical profession, and statins is a very good example, 99.9% of the medics involved in the statin world and cholesterol and so on have the same message. But there is a 1%, I don't like the word rogue medics, but they have their own individual views which are basically wrong. But very often they're the ones who get it. So the problem is the media finds this guy, or they find a bit of obscure research done somewhere and say, this now proves that statins don't work, or you get muscle pain if you have statins, or you get increased risk of this or that. And equally, there's some contrary ones as well. Could be positive, which are equally wrong. The problem for a health professional is he will often find himself having a medic quoted at him. How do you deal with that?
Yeah. It's a very good question. There's a very good example of that when Andrew Wakefield got huge publicity saying that MMR was not safe.
Yeah.
And as a result, vaccination rates for MMR nosedived temporarily, at any rate. And his research was totally discredited, but he got enormous publicity because of what he was saying. Now, the problem is that Ofcom, who regulate television, for example, say that you must have equal time given to an argument for and an argument against. Now, as you say, if 99% of doctors say, you know, we're for this, and 1% says we're against it, but you give them equal time, it seems as if, you know, the medical profession are equally divided, which is erroneous. Equally, if a TV editor says, let's show a child badly affected by inflammatory bowel disorders or autism, the public see that visual image and say, look what that MMR has done. It's irresponsible. And we have a duty to tell editors, please don't do that. And if you do interview somebody who's got an opinion that is the 1% of the medical profession, make sure you know that. So this doctor, although he's just in the minority, says this, but 99% that you've got to have the other view and state it very strongly. And that's where we've got to have a role to make it accurate.
Thank you. There's another question over there.
Thank you very much. I find that really helpful as someone who's steered clear of getting involved with the media because of fear, but thanks for the encouragement. One thing I found really helpful, I noticed you use the NHS Choices website to put up a lot of the controversial headlines, and I find that site really helpful because you haven't got a lot of time, but it gives information behind the headlines and gives people a balanced view, so it's a good site to refer patients to and encourage them to use.
Absolutely, there's some very good apps you can use which are authoritative, peer-reviewed, and you can instantly, on any day, what's the breaking news today? So whilst you're waiting, you know, to go to work, you've got 2 minutes before surgery starts or whatever, you can see what's the breaking news, oh, what's my opinion, get an opinion on that, just in case somebody comes in and says, you know, what do you think? It's really good to be on top of it rather than react to it, because it makes us look as if we don't know what we're talking about otherwise. So there's some good apps, there's some good websites, it's just finding the right ones, the reliable ones.
Any other questions? I just have one, it's just a question for you. Obviously, in your experience in the media world, have you ever come across where you've been put in a very difficult or awkward situation on the spot, where it's live TV, obviously? And
yeah. I mean,
and how do you deal with that?
I mean, this week I was talking about Charlie Gard, this child with mitochondrial DNA depletion syndrome, and clearly it necessitated sensitivity, you know. And a balanced opinion, but the program went live to the father of another child in the States, and the father was saying, Dr. Jones doesn't know what he's talking about. My son's 6 years old. He made significant improvement on this nucleoside treatment that we're doing at Columbia University. Now, you know, there was no opportunity for me to criticize him. It just would not have been sensitive or appropriate. So he had a go at me, but I was able to say, you know, sometimes when you look at all the evidence and your child can't be compared to this child because they have a different mutation, you can't compare the two. This child is the most severely affected child that the doctors in Columbia have ever seen. They don't know if it would work. They don't know if there'd be any improvement. And what improvement you got would be very minimal. It was a situation that required quite sensitive handling. So I was able to make some points about you can't compare the two. That I defended the doctors at Great Ormond Street by saying they have the knowledge of this case. They have compassion. They have caring. And far from them withdrawing treatment and giving this child a death sentence, what they're doing is saying, we don't want to prolong this child's suffering any longer. So it's not death sentence or treatment, it's treating for the sake of keeping alive or ending prolonged suffering. Difficult subject, and of course there was a lot of controversy afterwards, but you know, you can give an opinion, but in some areas you have to be careful and sensitive and, you know, caring. Otherwise, you're crucified.
Right. Any other questions from anyone? Okay, if that's the end, thank you very much
Thank you
again,
very much.
and thank you
Thank
for Pill Time for sponsoring the session.